We're glad you're here tonight to join with us in celebrating the 20th anniversary of St. Francis and St. Gertrude's and the St. Francis campus. Shortly there will be stories that are better illustrations of what we're trying to do here both philanthropically and what these organizations and this campus is trying to achieve in the community. Enjoy your time with us tonight and enjoy these stellar stories.
I'm a real estate consultant here at Canterbury Park in Shakopee. Canterbury Park's a very busy place during racing season. I get to work with almost everybody that's on the executive team and the community, the city manager. My wife and I have been married for 34 years, and we've had 4 children. 3 out of 4 of them are grown and out of the house. 2 actually graduated from college already. Last fall, I stepped on a piece of glass. I got a little infection going in my foot. By Thursday, it hadn't gotten any better. So I came down to the emergency room at St. Francis. And I thought that I'd just get a stronger antibiotic and everything would be fine and off I'd go. Well, the emergency room docs took a look at it and said, no, you're not going anywhere. You're checking into the hospital. Saturday morning rolls around and the infection had turned septic.
It was initially obvious that he needed to be operated on urgently because this was an infection that was spreading and was very critical.
By 1 o'clock that afternoon, the team had been assembled. They removed the bad tissue and they said it's going to be probably a 6-month recovery process. The wound nurse, Joel, came in and I said, I can't believe it's Tuesday and I'm still here. And he said, I can't believe you're alive.
I don't think he realized the severity of it, the very real possibility of amputation, where essentially half of the foot is taken off.
If Bob had waited too long, or if it hadn't been appreciated by the medical team soon enough, this could have led to loss of a leg and loss of life.
I had 3 reconstructive surgeries, all at St. Francis. Each one of those surgeries, the foot got better and better.
I met Bob, and the first thing he said to me is like, well, I want to climb Kilimanjaro in September. And this is end of January, and I'm like, okay, we have a goal. Bob's success is greatly due to Bob. He asked the right questions. When he didn't know what to do, he called the right people. He was able to play golf, not climb Kilimanjaro, but play golf by June. We compromised.
There's literally tens of thousands of us out there that St. Francis served last year. The healthcare professionals, the techs, the facility is all there when you need it most.
I love what I do. I know that I can help people help themselves. That, I think, is what gets me coming back to work every day.
There's a sense of community, there's a sense of working together, better communication between different people who are involved in the care of an individual patient.
It's bringing a patient back to the standard of living that they want, what they want to do with their families, and what they want to do with their life. I think you try not to think about that too much in the moment because it's so huge.
I've got a lot to live for, and to think that it could have all been over when you least expect it. Among many things that I'm grateful for, I'm grateful that I chose to come to St. Francis that night.
I'm Laura McConnell. I'm married to Oliver McConnell. We've been married 67 years, 7 children. We managed a farm for my brother, and all the kids had help. We also belonged to the polka club, and we used to go to all the polka festivals. Music, he loves it. Oliver used to be a steam engineer. He traveled from Belle Plaine to Minneapolis every day. Oliver retired at 72 years old. He loved what he was doing, but He was starting to have health issues, and then he got a blood clot behind his knee, and they had to amputate his leg. So then he came to St. Gertrude's.
Some of the building blocks of this career field is recognizing the importance of offering dignity and respect and resident choice. It's just really focusing on what that person wants.
He voted to you. Down by the riverside, you know that one too. Down by the riverside. I come here every day to help him with breakfast and help him with lunch. He gets up at 11:15.
Hi, guys.
And then we go to exercise, the wellness program. They do finger exercises and bicycle. This is great for him. After exercises, we go outside, we tour the gardens. We know almost everybody at St. Francis and St. Gert's, and it's great.
I looked at some old pictures and found a picture of Mom in her nursing assistant uniform. She started to work as a nursing assistant, and then she worked 20 plus years as a cook in long-term care. Now, she's been in St. Gertrude since June of 2012. If you say, "Mom, how do you like it here?" "Oh, girlie, I couldn't live in a better place," she'll say. If they don't like it here, they won't be happy in heaven. When we started looking for a placement for my mom, I actually walked in here and I saw happy people, happy residents, happy staff. I just thought this was going to be a place that I know I could rest at night knowing she was here, and I do.
This is very convenient for us. You got the hospital, the ER, and the clinic all attached. You know he's getting good care.
My mom, she's thrilled to be here. I would say, "This is a journey we're on, aren't we?" She would say, "Yeah. We've never had a bad day, have we, girlie?" We would talk about how good we have it.
The stories that you've just seen are stories that we see on this campus on a day-to-day basis. I hope you will join with me and others by becoming a philanthropic partner with us as we move towards the next 20 years of care being provided on this campus in this community. So thank you for being here. Thank you for joining us. And I hope you enjoy the journey for the next 20 years.